Hello everyone. Welcome to my SSD Research Proposal Digital Presentation. My name is Crystal Crane and I will be presenting on the case study The Raven by Perry and Salovitz. The client in this case study is a 17-year-old high school student named Amber who was found lying unconscious by another student in the girls' bathroom. Paramedics were dispatched to the scene where they discovered her breathing was short, her heart rate was fading, and she was unable to be awakened. After being admitted into the hospital, it was inconclusive as to what brought Amber to this state. Initially, physicians thought that this incident may have been an attempted suicide or the result of a heart attack or even a stroke. A possible cause was identified after the child psychiatrist assigned to the case had talked with Amber's mother, Jill. Amber had been self-mutilating through the act of cutting, which appeared to have induced a comatose state of mind due to the substantial amount of natural opioids that were released in her brain. After various other medical tests had come back negative, the doctors decided to verify the hypothesis by administering an opioid antagonist. Within minutes, Amber was once again conscious and appeared to be returning to her natural state. Upon her admittance into the hospital, it was unknown that Amber had suffered from childhood sexual abuse. An unfortunate situation had recently occurred, which brought these painful memories back to the surface. Amber did not know how to cope well with these unpleasant feelings and attempted to soothe her anxiety by committing acts of self-harm. It was evident that Amber will require further care to deal with these problems in the future. Amber was carefully monitored throughout the night and would be sent home with her mother the next day. The child psychiatrist offered to work with her following her release, and Amber hesitantly agreed. Both of them will work together over the course of several weeks to uncover some of Amber's deepest, most traumatic memories. The treatment process will begin the journey towards Amber's recovery and positive state of well-being. Individuals who were mistreated or abused as a child are at a greater risk of suffering from health risk that could potentially result in life-threatening situations. They may suffer from physical symptoms such as chronic pain, weight loss, and fatigue, or mental disabilities such as anxiety, depression, or post-traumatic stress disorder. This study will examine the effect of trauma-focused cognitive behavioral therapy on self-harming behaviors among adolescents with a history of sexual abuse. Social workers are relevant to this study and important to research because they have more interaction and direct contact with abused children more frequently than other occupations. They are considered experts in the area of abuse and are frequently relied upon to provide education and resources for families dealing with child abuse issues. Additionally, because of their skills and proficient knowledge about child abuse, social workers are regularly involved in legal matters as well. Research studies to gather empirical data on children with self-harming behaviors has been substantially limited. Considering that deliberate self-harm is usually comorbid, it can be difficult to diagnose patients suffering from multiple conditions. Based on the literature reviews included in this study, it has been determined that trauma-focused cognitive behavioral therapy is an appropriate method of treatment for youth. Other findings have suggested that children do not have strong support systems, are using ineffective coping strategies, and avoid seeking help for their problems. Continuous research must be applied in the field so that a consensus can be reached on the type of treatment used for adolescents. The purpose of this study is to analyze the outcome of trauma-focused cognitive behavioral therapy on self-harming behaviors in adolescents affected by childhood sexual abuse. Expected findings will confirm that the existing knowledge from the previous research will support the research questions in this study. Based on the summary of literature review included in this study, it had been discovered that specialized testing measures have not been created for children suffering from post-traumatic stress disorder, and additional guidelines will need to be implemented. Another literature review analyzed the self-harming behaviors among adolescent females of sexual abuse. Results showed that at least one form of self-harming behavior had been reported for more than 60% of the girls participating in the study. Another study reviewed the results of the outcome studies that use psychotherapy approaches for adult survivors of sexual abuse. Results indicated that not one method was more efficient than the other, although trauma-focused cognitive behavioral therapy seemed to have greater benefits overall. Another study that was conducted completed a systematic review that primarily focused on children suffering from trauma-related disorders as a result of childhood maltreatment. Results showed that trauma-focused cognitive behavioral therapy is the most suitable approach towards treating children affected by childhood maltreatment. The following research question will be tested in this single subject withdrawal design. Will trauma-focused cognitive behavioral therapy decrease the frequency of self-harming behaviors in adolescent victims of childhood sexual abuse? The independent variable in this study is trauma-focused cognitive behavioral therapy, and the dependent variable is the frequency of the self-harming behaviors. The client in this case study will be assessed using the ABA single subject withdrawal design. This type of design incorporates a follow-up after the intervention phase is complete. Client assessment will occur prior to the start of the intervention, and 3 baseline measures will be taken to discover a pattern. Creating a baseline is essential to treatment because it will serve as a guideline to determine the overall effectiveness of treatment. During the treatment period, at least 3 more measures will be performed. This type of withdrawal design is being implemented because the follow-up session will determine if the intervention was effective or if treatment needs to be resumed again. This is an example of an ABA withdrawal design graph. On this graph, you can see where the measurements were taken on the client's assessment during week 1, week 2, and week 3 of the baseline measurement period. And then in 2-month increments, measures were also taken during the intervention period. At the end of the intervention, 6 months later, a follow-up measures were taken. They were taken also in weekly intervals. The independent variable in this study is trauma-focused cognitive behavioral therapy. The dependent variable is the frequency of the self-harming behaviors. The intervention strategy will be trauma-focused cognitive behavioral therapy that will occur during individual sessions that take place for 1 hour each week. The length of the treatment period will be determined based on the positive rate of change in the frequency of the self-harming behaviors. The target of the intervention will aim to reduce or eliminate the frequency of self-harming behaviors, create positive coping skills for the client, and to maintain the client's safety above all. Approximately 6 months after the intervention has concluded, a post-follow-up session will take place which will consist of 3 more repeated baseline measurements. The following variables may confound the outcome of the intervention: client participation and attendance. To address these issues, the client's mother will agree to and sign an informed consent agreement which outlines the importance of participation and attendance at the therapy sessions. This is an example of the informed consent agreement. On this form, it will outline the purpose of the study, the benefits and risk of therapy, the confidentiality of the client, payment and cost of the study, and their right to volunteer and participate in this study as well. Due to the nature of this crisis, data collection will begin immediately. This will require that data collection procedures begin while the patient is still hospitalized. Information will be collected by various individuals to include the hospital physician assigned to the client, the mother of the patient, patient self-reporting, and the therapist who is administering treatment to the client. Prior to the start of treatment, 3 baseline measures will be taken at the time of hospitalization, post-discharge, and at the first scheduled therapy session. The types of data that will be collected will consist of, but are not limited to, the patient's medical records, the discharge report prepared by the physician, observation made by the client's mother, and the initial interview. The client will be evaluated before, during, and after the treatment phase using the risk-taking and self-harm inventory for adolescents. This is an example of an ABA withdrawal design graph and how the information collected at the time of measurement can be taken to put in a different type of chart that is a little bit more pleasing to the person viewing the information. Here you will see how the rate and severity of the self-harming behaviors is rated, and it can range from mild, which is from 0 to 2, moderate can be 3 to 5, and severe is anything above 5 in the range of 6 to 10 or even more. At the time the client entered the hospital, the rate of the self-harm was at a severe rate. During the treatment phase, as expected, the frequency and severity of self-harm decreased to a mild level. Near the ending of treatment, the behavior began to result in a moderate level. One testing instrument will be utilized to measure the dependent variable. The therapist will use the risk-taking and self-harm inventory for adolescents to measure the rate of severity and frequency of the self-harm and risk-taking behaviors. The content of the items includes subjects about intentional self-harm, eating disorders, risk-taking behavior, and suicidal ideation. Based on prior research, this inventory has high reliability based on the scores from inter-item and test-retest reliability. The inventory has also shown enough substantial evidence to validate the measure's concurrent, divergent, and convergent validity. Here you will see an example of the risk-taking and self-harm inventory for adolescents. This inventory is comprised of 38 items, 3 of which are yes or no questions, and 2 provide areas for short answer responses. A total of 34 items are scored on a 4-point Likert scale, ranging from 0 for never to 3 for many times. There are 8 items rated for risk-taking behavior and 28 items rated for self-harming behavior. Quantitative data will be measured and collected by calculating the scores from each component and then divide by the number of questions answered from each category. The risk-taking subscale can range from 0 to 24, and the self-harm subscale will range from 0 to 84. Higher scores indicate the frequency and severity, ranging from mild to more serious risk-taking and self-harming behaviors. The expected findings of this research paper is to determine if trauma-focused cognitive behavioral therapy will reduce the frequency of self-harming behaviors in adolescent victims of childhood sexual abuse. These findings are expected due to the previous research that is in support of using trauma-focused cognitive behavioral therapy to treat youth suffering from trauma and sexual abuse. There is a significant need for continuous research that will validate the most suitable intervention strategy used among the youth population. Recent research suggests that trauma-focused cognitive behavioral therapy is an appropriate form of treatment for children and adolescents. This study will help substantiate the existing knowledge and evidence from previous research. Here you will find the reference lists included in this study. This concludes my presentation, and thank you for listening.